go to our good friend Dr. Sanjay Jain, a board-certified physician, Skyping in today from Washington, D.C. Doctor, we thank you for your time and welcome back to America's Forum.
Thank you for having me. How are you doing today?
Well, doing fine, but obviously there's a lot of concern about Ebola, so we need your help. First of all, explain to us briefly what Ebola is, how does someone contract it, and how does it spread?
Well, a lot about what's happening now is, at least in the media and the public right now, is really about a little bit of hysteria in terms of this virus. And so this virus it's very contained in terms of how it's spread, in that the onset's very quick and is very fast, and it can be very deadly. So about 50 to 90% actually die from this. So by the time someone gets this virus, they're usually very weak to actually travel. So it takes about 2 days to, I would say, about 3 weeks to get the symptoms, and very common symptoms such as nausea, vomiting, diarrhea, high fevers. But the problem with this virus is so fast acting and it's very deadly. And so, looking at the Hollywood movies, Outbreak, which is kind of popularized this whole virus outbreak, and then also the Planet of the Apes, when the whole world was overtaken by this virus. So I think the public has this perception and fear about this virus. And what I basically want to say is there is concern that anything's possible, but right now it's pretty well contained in the CDC and the World Health Organization are doing a great job maintaining this and keeping an eye on this virus. But it's really important to kind of be mindful of it and be aware that, especially during times like this, as a physician, it's important to realize that, even though it might not be endemic in the U.S., if there's someone who's recently traveled from Africa and come here, and they have similar symptoms, caution is advised.
Now, Doctor, I have a question for you. As someone that travels regularly, if someone were to board an aeroplane with Ebola, would it be contagious to other passengers on that plane?
Well, the problem with air travel, you are in a closed environment. So the airplane is probably one of the worst places to be in when you have, an infectious disease like Ebola. So that's why it's very important to screen for some of this before people get on board, even the airline officials, to really monitor the situation, because all it takes is one person to be infected, and you don't know where this person's traveling, what the itinerary is. So just like people get the flu from the travel and other diseases, it's very important to kind of be mindful of it.
Doctor, in this post 9/11 age, is it possible that Ebola could become weaponized and used against our country, and are we prepared to handle anything like that?
Well, I hate to use the word weaponize, but it would be the most foolish thing for humankind to weaponize something like this. There's been anecdotal talk about people previously weaponizing smallpox, and so to weaponize Ebola would be almost the most foolish thing any government entity would ever consider, because they would be shooting themselves in the foot, because there's no treatment. There is no vaccine to treat Ebola virus. So you're basically doing harm to yourself by basically supporting this. So I really doubt that this would be something to weaponize, but I can't speak for every government.
Now, Doctor, looking at precautions, I want to ask you, is America prepared for this? And if they are, and if they're not, what can they do to protect themselves?
Well, first of all, the Ebola virus is transferred by two ways, bodily fluids and blood. So unless you're in a situation where you're going to be in contact with those type of situations, you're okay. TB, cough, and in terms of actually inhaling something, that's not really a concern. So really you have to understand which environment you're in. It's very common, especially in Africa, that this is actually transferred in hospitals, because a lot of sick people come in, there's a lot of transfer of fluids. Even though they try to keep sanitary conditions, some of these third world countries don't have the type of sanitation we have in the US. So unfortunately, in the hospitals, these are really bad areas where things are transmitted. And these health workers that are out there, they probably don't have the best conditions to work in compared to the US. So as a traveler, I wouldn't be as concerned, but as a health worker in those environments, it's a lot of concern.
Dr. Sanjay Jain, you've seen the studies about infections befalling patients in American hospitals, certainly with what we presume to be much better sanitation and facilities than what is encountered in Africa. But I'm wondering about the talk we're hearing about possibly bringing this Ebola virus back to the United States. Officials say that under closely controlled circumstances, I suppose to do research to try and deal with it. Do you believe that is in the process of happening or will happen very soon?
In terms of Ebola crossing the ocean to the US, I think the probability is very remote. But the concern is that in Africa, this virus has been very well contained, but one traveler traveled 1,000 miles from Liberia to Nigeria, which is a first. It's never skipped that far. It's always been well contained in these villages, these small areas. So that's been a little bit of a concern in terms of skipping 1,000 miles from one area to another. So if it can skip that far, 1,000 miles, it can easily skip to a neighboring, like Eastern Europe or Western Europe. So you're talking about those countries that could be possibly affected. And then you got travelers from Europe coming to the US. So I don't see a direct Africa to US connection, but in terms of a carrier from another country, maybe in the European countries that I mentioned, it's a possibility. So right now, the governments in Africa are really keeping an eye. They're actually stopping flights that are leaving Liberia and some other countries in Africa to kind of monitor it so that these travelers don't go outside of the continent to affect other people.
And Dr. Sanjay Jain, unfortunately, will have to stop our discussion right there, but we appreciate your insights on Ebola, and we look forward to our next visit. Thanks very much.
Thank you so much.
So, Ebola and the threat it presents. Do you have some thoughts on that? We'd love to get your comments. Tweet those comments to us at Newsmax TV, #America's Forum.